Einstein Healthcare Network is about a little over $1 billion business. We have 4 hospitals, 500 employed physicians. Back in 2007, we made a very strategic decision to make a large investment in advanced clinical information systems, electronic medical record. We went through an evaluation process with both our internal information technology staff, but more importantly, our user community.
For example, they gave us different options of laptop, and we had an opportunity to work with it just to feel for it, and we ended up choosing the C1 Toughbook.
We've rolled out about 250 Toughbooks throughout the institution.
We recognized clearly there were a number of clinical folks that are mobile users. They move, like our physical therapists, move from unit to unit. They care for patients in multiple different locations, and that the easiest tool that they could have is a mobile device that they could take with them.
The C1 Toughbook was very lightweight, easy to transport, which is very important to us because we need that when we're working with patients.
What I really like about it is that there's a wireless feature. So anywhere throughout the hospital, in my office, in a patient's room, at the nurse's station, I'm connected to the intranet in the hospital. So I can access any file I need to, I can access email. It's just really convenient. I don't have to wait to go to my office to get on the computer or get to the nurse's station to get on a computer. I can get on it anywhere I need to.
All of the documentation, particularly around the physical therapy, a lot of that was on paper, and so we were looking for the same chart, looking for the same material, and now the physical therapist has direct access to the information from other clinicians and caregivers, the rest of the team that care for the patient.
Before we had to physically go to the nurse's station and get the medical chart, and a lot of times it's not available because the physician may have it or nurses maybe have it.
What's really changed for me is that now I can carry my laptop, the Panasonic C1, and all of my documentation is here. Not only can I read my own notes, I can read the physical therapist's notes, the doctor's notes, any new orders that have come in. So it's just really more convenient, and I can have more information at my fingertips.
We've seen a huge reduction in the challenge of looking for records and trying to find out what's going on with a patient. We've been able to quantify that people are getting time back because they have access to that information.
It allows me to access a patient's medical chart. So if a patient comes to me and says, wow, I'm really not feeling well, and you know what, they took me down for a medical test today. Well, then I'm like, oh, well, let me see what that medical test was. And it is so convenient that I don't have to run down the hall to the medical chart. I can just tap on a couple things, and there's the results I needed. I can just get a lot of information that I need right through the Toughbook.
The ability to have that mobile functionality without having ongoing complaining or concerns about the functionality based on the ruggedness, it's actually quiet from my perspective, which is good.
We can drop things, spill things, there's a lot of things going on in the clinic, and I know that this thing is not going to get ruined.
It's been very durable because we're always sitting there, I'm eating my lunch while I'm typing, and it goes with me everywhere.
The people are very pleased with how the devices work, how robust they've been, how little breakage we've had. They really couldn't be more pleased with what we've deployed.
It has made me more efficient because I don't need to keep track of all my loose papers, and that I can bring it right with me while I'm sitting right next to the patient.
It's so much more convenient than paperwork.